Hey, everybody, welcome aboard. Welcome back. It's the second hour of Fire Your MD now. So much to know, so much to understand, so much to, embrace and expand the consciousness with. And this is really what we're up to here, giving information for free to anybody who has the ears to hear. And quite frankly, everybody needs to know what we know, so we encourage you to become a member of Longevity and join our grassroots coalition of the informed. Help us to spread our message of foundation medical nutrition for the masses, to the masses, because everybody needs this stuff. Everybody feels better with this stuff. This stuff is essential, no pun intended. And when people, don't know what they're missing, and their medical doctor is clueless about any of this, because their MDs have no training, no experience, no respect, and no appreciation for medical nutrition, and so the MD is completely unable to help people with medical nutrition, and yet they give people advice all the time. Oh, no, don't take that selenium, it's dangerous. Even though selenium was proven to be an essential nutrient in the 1950s, was proven to be an essential nutrient in the 1950s. There is so much information about the positive effects of selenium on human health that the founder of Longevity, Dr. Wallach, was able to secure for Longevity a qualified health claim from the Food and Drug Administration regarding selenium. And in order to get a qualified health claim from the Food and Drug Administration, you literally have to bring truckloads of published research regarding what you're talking about, in this case, the positive effects of selenium on human health, and give it to the Food and Drug Administration. So because of Dr. Wallach's research, we can legally say that selenium supplementation reduces breast cancer occurrence by 82%. Prostate cancer by 64%, I believe, colon cancer by 69% maybe, and lung cancer by 39%, even if you are a smoker. Selenium. If a medical professional tells you that selenium is dangerous, that's like a medical professional telling you that sunlight is dangerous, that oxygen is dangerous, that calcium is dangerous. Oh, wait, they already do that. I must be wrong. Let's go back to the phones and get some questions answered. Wendy from Iowa is up. Hey, Wendy, thanks for the call. You are live.
Hi, Dr. Glidden. I wanted to do a little bit of tweaking for a colleague who's 51 years old. He has a history of bladder infections and now has bladder cancer. He's been doing much better. You've had him doing the anti-aging pack for selenium, some Z-radical. What I want to run by you is when he walks a lot or exerts himself, when he lifts anything heavy, he gets in a lot more pain and he has a lot more blood clots. Now, when he took glucogel for his knee, it seemed there was a bit of a pattern there that he would get better. And does that make any sense to you with bladder cancer? Or is it just our imagination that the glucogel is helping?
What do you mean he would get better in what regard?
Any pain he had, and also blood clots. It seemed to improve when he was taking the glucogel, which was for his knee, but it just seemed that his other symptoms were getting better.
Well, I mean, that's interesting. Everything's connected. I've never heard of that before, but if that was his experience, then we need to lean heavily on that. So I would say, look, go back to the glucogel.
Okay.
Was it the glucogel caps, or was it the glucogel caps or the glucogel liquid?
It was the capsule.
All right, so go back to the caps. Now, the other thing not to overlook here is the research clearly shows with bladder cancer specifically, remember, we don't treat bladder cancer, we don't treat cancer, we don't treat anything on this radio show. We support and promote the body's ability to optimize its structure and function regardless of the disease process. So, however, the research clearly shows that supplementation with probiotics greatly reduces the return of bladder cancer once it's been eliminated through some type of means. So Flora FX, Nightly Essence, Root Beer Belly from Longevity. Okay. Quite frankly, any type of probiotic that you can get your hands on that's of good quality is the way to go. I would lean on Root Beer Belly first. Well, you know what? Because of the blood clot issue, I would do Nightly Essence. Because the Nightly Essence, in addition to the probiotics, also has a biochemical in it called nattokinase, Nattokinase, which has been documented to dissolve blood clots.
Oh, okay.
So I would give him the nightly essence moving forward. I'd give him 3 before bed and 3 in the morning. Also, essential fatty acids have been proven to virtually eliminate the risk of thrombotic stroke. And they do that by normalizing the viscosity of blood. Again, this is another qualified health claim that Longevity was able to secure because there are mountains of published research papers that support this. So I would max out on essential fatty acids. I take like 15 to 21 essential fatty acids a day.
Okay.
And, our take on supporting the immune system, right, with people that have a diagnosis of cancer is 100,000 ORAC points of antioxidants a day, however you can get it. 100,000 ORAC of antioxidants a day would be very, very, very important. And, of course, we don't overlook the obvious. Eliminate the 10 bad foods.
Right. So in the foods that are the good foods, what should be the ratio of protein and greens and eggs? Is there more of one of those he should be eating?
Nope, I don't really care as long as he's eliminating the 10 bad foods. Just have him follow his appetite and see what happens. Immune health is made from protein. Your immune system is made from protein, but too much protein in the diet will make the blood acidic, and that's a problem. So really, my experience with dietary disciplines is that once you've eliminated the 10 bad foods and your body's nutrified, then your appetite kicks in and your body will tell you what it needs.
Okay.
So I'm not going to get bogged down in those details. If you want to get bogged down in any details, make it be 100,000 ORAC of antioxidants a day, 100,000 ORAC of antioxidants a day. Acidophilus, 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 more EFAs. Keep your fingers crossed and stay in touch. Thanks, Wendy. I appreciate you very much. California. Next. Yeah, California. The ex-gubernator of California is going to talk to us. Arnold Schwarzenegger. Oh, no, it's Brian instead. Hey, Brian, thanks for the call. For a minute there, I thought you were Arnold Schwarzenegger. What's up?
Yeah, I've got a friend that I've known for 40 years, and he's got prostate cancer, and I didn't find out about it until he'd already elected to have radiation pellets implanted in his prostate. And I'm wondering if he can, through longevity, fortify his system and regain his health from the prostate cancer.
Well, we don't treat cancer and nobody knows. And in a perfect world, we would have answered this question years ago because conventional medical doctors are not successful in treating cancer. They're not. They are not successful in treating cancer. They are not. If you look at the statistics for cancer rates of survival, they're nil. They're bad. I mean, their generation of cancer treatments doesn't work. It doesn't work. That, at best it prolongs life a couple of years and adds into the bargain lots of suffering and personality change and energy change and your teeth fall out and your hair fall out. Oh, but you got 2 extra years of life. Well, thanks a lot, Doc. So They've completely dropped the ball, but because they monopolize the industry, nobody else is able to give it a shot, right? So that's why there are no alternative cancer treatment centers in America. There aren't because it's illegal. So, right? I mean, in a perfect world, man, what my colleagues would have been doing cancer research for 100 years. But we haven't because the MDs have, bullied us out. And, the pharmaceutical industry holds sway over the practice of medicine all around the world. It's no different in Europe. It's no different in India. It's no different in Australia. I mean, honestly, what we need is some sheikh from, Dubai to give us $1 billion to set up a real, legitimate, holistic cancer research foundation, and then we'll have this question answered in 5 years. But right now, all we have, man, is anecdotal evidence from spurious people all around the world, and who knows? I don't know. All I can tell you is selenium supplementation reduces the occurrence of prostate cancer by 64%, and that's a remarkable degree. So if I had prostate cancer, one of the things I would do to support my body's ability to bounce back would be to take selenium, right? So I don't know whether or not he's too far gone. Remember, we can't treat this legally, but we can give the body support, keep our fingers crossed, and see what happens. And so the recommendation there, of course, would be the Healthy Body Start Pack 2.0 liquid. One of those. 2 bud, give him 2 bottles of plant-derived minerals. 2 selenium per 100 pounds of body weight per month. And as much Z-Radical as he can afford.
Okay, thank you very much, Doc.
All right, I appreciate you. Thanks for the call, man.
All right.
You're the greatest. I appreciate it very, very much. Terry from Virginia is up next, but we don't have enough time to talk to Terry from Virginia. So we're going to bring Terry up at the beginning of the next segment. And ladies and gentlemen, if you like what you're listening to and you're listening on terrestrial radio, then listen during the commercial breaks for the phone number that your radio station gives out. Call that number for information about the health products we're talking about here or about the business opportunity that the Longevity Company brings to the table. If you're watching us on YouTube, if you found us all by your lonesome and you want information, you can either go to drglidden.com, get information there, or give my team a call. The number to dial is 855-347-3696. That's 855-347-3696. And if you were invited to this radio program by a pre-existing Longevity representative, get with them to find out information about how you can proceed to interface with the company led by the physician who literally wrote the book on medical nutrition, who has sued the Food and Drug Administration on your behalf, and quite frankly, who is the world's leading expert on pathophysiology and its relationship to environmental stress and medical nutrition. Dr. Joel Wallach does not get any better than that. Stick around. Welcome back, everybody. Dr. Peter Glidden here. Check out the live stream, the drgliddenshow.tv. Let's go to Terry in Virginia, jawbone infection. Hey, Terry, what's up?
Hey, Dr. Glidden.
Hey, Terry, what's going on down there in Virginia?
Hey, how you doing, Dr. Glidden?
Well, I'm
doing
good,
right?
but I think I'm going to get better. What do you think?
All right, then.
All right, I think I might.
Yeah, I'm calling today about my brother Adam, who lives here with me.
Mm-hmm.
He's 5'8". He weighs 140 pounds. He needs to pick up some weight, but he can't always, get the proteins and fats, and so he's fluctuating between the good and bad foods. He recently went to the dentist. He'd been having a really bad toothache, and he'd already taken about a half of a bottle of the extra strength Tylenols. And so he went to the dentist, and they x-rayed his teeth. And here's what they said. They said that he has rampant decay with advanced periodontal disease. Numerous teeth are fractured or non-restorable, abscess present. Clinically, most, if not all, teeth deemed non-restorable due to decay, periapical lesions, periodontal disease, and complete lack of oral hygiene. Recommend full mouth extractions due to the above conditions. Concern of infection spreading through the bloodstream, causing further medical complications. They said he had an infection in his jawbone, and they put him on amoxicillin, 500 milligrams 3 times a day, and he will be finishing his last capsule this evening, and we need to know what you think about it.
Well, when all you have is a hammer, everything looks like a nail, and the dentists, the MDs, having no experience with medical nutrition, they see a problem. They can't see any resolution for it, and so their thing is just rip everything out. Just rip it out. Rip the teeth out, rip the appendix out, rip the tonsils out, rip the adenoids out, rip the breasts off, rip the appendix out, rip the uterus out, rip the ovaries out, rip the knees out, rip the hips out. What the hell? You don't need those. So my recommendation is, right, when it's a non-life-threatening condition, use surgery as a last resort only, and give medical nutrition a chance. It's either going to help him or it's not. But even if it fails, his body, after 90 days of medical nutrition, is going to be in a much better space to handle a surgery like that, because that's a gigantic stress to the body. That's a big, bad voodoo daddy. And, you wouldn't go into snowy weather in a bathing suit. Well, you don't want to go under the surgeon's scalpel in an undernutrified body. And if his body has this much periodontal disease, it's undernutrified. So the recommendation for him is, eliminate the 10 bad foods. He needs to get a bottle of the plant minerals. He needs to mix 1 ounce of the plant minerals with 1 ounce of either the Cal Toddy or the Osteo FX. The Osteo FX would be better for him, the Beyond Osteo FX. 1 ounce of the plant-derived minerals, not the cherry mints, the plant-derived minerals, 1 ounce of the Beyond Osteo FX. Mix them together. Have him hold it in his mouth, swish it around in his mouth for 2 minutes. 2 minutes, 120 seconds, 2 minutes, and then swallow it. Have him do that 3 times a day. And then I want him to rinse with 1 bottle or 1 ounce of plant-derived minerals in 1 ounce of water. 1 ounce of plant-derived minerals in 1 ounce of water. That's what I want him to rinse the teeth with after he's done the first prescription. Then I want him to rinse his mouth with 1 tablespoon in 1 ounce of water of colloidal silver. 1 tablespoon in 1 ounce of water, 1 tablespoon of colloidal silver in 1 ounce of water. I want him to put that in his mouth, swish it around in his mouth for 2 minutes, and then swallow that. And that's what I want him to do. I want him to do the calcium and the plant minerals in the water, the colloidal silver in the water, in that order 3 times a day. In addition to that, the Beyond Tangy Tangerine, the selenium, the essential fatty acids appropriate for body weight, and last but not least, give him 1 bottle of Killer Biotic. Well, give him 2 Killer Biotic capsules 3 times a day with food. 2 Killer Biotic capsules 3 times a day with food. And if he doesn't stop eating the 10 bad foods, have him start shopping for dentures today, because he's going to need them. He needs to clean up his diet. He needs to give his body, this is like, giving somebody the paddles who has a heart attack. This is an emergency intervention. There's no slacking. There's no putting this off. There's no cutting the therapy in half. He has to go for it. He has to go for it hard. Damn the torpedoes. Full steam ahead. Keep his fingers crossed and have him call me back in 4 weeks with a report. Demetrius from Georgia is up when we come back. Stick around, folks. Mission Impossible? Seems like it sometimes because, people are so enrolled in their own madness. The saying goes that we rattle our chains to celebrate our freedom, right? Oh, yeah, let's pass the Patriot Act without even looking at it. No problem. We rattle our chains to celebrate our freedom. We rattle our prescription medications and our monthly insurance payments to celebrate our health. We need our heads examined. Well, not members of Longevity Nation. Members of Longevity Nation have popped out of the medical matrix. They've taken a hard look around. They've seen the unbelievable depravity which is levied upon humanity by reductionistic medicine. And they're standing up and speaking out about it. Politely, kindly, in a non-militant way, right? Look, I know a doctor that says you don't have to suffer with that. If I send you a link to this radio show, will you listen? If I send you a link to one of his webinars, will you watch it? If I lend you this DVD, how about it? We've got a whole bunch of DVDs in the back office. Got a whole bunch of DVDs. Check out the titles here. Check it out. What do we have here? I don't know if the camera can pick this up. Well, I'll tell you what that it is. Maximizing absorption of supplements. Healthy weight loss. A strong body without cancer. Healthy blood sugar. Healthy bone and joints. Cholesterol myth busting. Healthy heart and blood pressure. Now, do you know anybody in your life that would need to watch those? This is all that we do. I know a doctor that says you don't have to suffer with that. If I lend you a DVD, will you watch it? If I send you a link to a webinar, will you watch it? That's all that we do. And, then let people decide whether or not they want to take the plunge. Give a little sample, not a bad idea. Give a sample of Beyond Tangy Tangerine. Give a sample of Rebound FX. Give a sample of CM Cream. Give a sample. Give a sample of the Pollen Burst, right? Whatever it is, people are going to respond because they're going to like how they feel, and the information is going to make sense because we speak about truth, and truth rings true. You know, you can tell when somebody's lying. You ever notice that? You can tell when somebody's selling you a sack of crap. It's especially apparent during political elections, right? Because it is the rare politician who tells the truth. And you just tell that they're lying. I mean, you can tell. And you can tell when people are giving you a crock of crap and when people are straight shooters. So all that we need to do in the Longevity Nation to be successful is tell the truth and point. Speak as little as possible. Listen as much as possible. Tell the truth and point. And then it gets very, very interesting. Let's go to Georgia and talk to Demetrius. Hey, Demetrius, thanks for the call. You are live.
Hey, Dr. Glidden, how you doing?
Pretty good, man. What's up?
Well, I was calling because I had a couple of questions for you. One is pertaining to my grandmother. She's actually going through dementia right now, and she's also a diabetic. And I was wondering what you would recommend for her. And also, is there any validity to drinking high pH alkaline water when it comes to helping your body when it comes to,
well, the whole pH thing is misunderstood. And the body, the idea here is that when the blood becomes acidic and when the cellular environment becomes acidified, it's not good, and that much is correct that it's not good. But the body has buffering systems in place that it can use to leverage to stop this from happening, and the body really doesn't want its tissues to become too acidic, because if that happens, you go into a coma. It doesn't want the body's tissues to become too alkaline either, because you get real funky if your body is too alkaline. So the buffering systems of the body attempt to maintain tight control over this. The buffering systems burn right through your minerals, however. So one of the best ways to ensure proper pH of bodily tissues is by upregulating or by giving your body enough of the essential minerals that it needs. So if somebody is taking Longevity's mineral supplements, they don't need to worry about upregulating or making their body more alkaline, because the pH system is supported and the body's taking care of it. Now, you can make the argument that alkaline water is more easily absorbed by the body, and that's true. And so I think most people in the world are dehydrated. I think most people would benefit from drinking more water. Whether that, necessitates the expense of the Kagan water machine, I don't know, $4,000. I don't know if it's worth it, quite frankly. So that's what I have to say about that. And if you do have an alkalizing water machine, just make sure you're not drinking alkalinized water with a meal, because that will neutralize your stomach acid and interfere with digestion. So that's a bad idea. Drink it between meals, not with a meal. Right.
Right.
So,
is there any? I was just going to ask real quick. Is there any negativity with taking alkaline water with like tangy tangerine?
No, not at all. It will probably increase its absorption. Quite frankly, you probably increase its absorption.
Oh, okay.
Yeah. So, and alkaline water is more easily absorbable by the body, and most people are dehydrated. But I just don't know. It all depends on where you're getting it and how much it costs, and there's a cost-benefit ratio to everything, right?
Sure.
Right. So now for dementia support, the first thing that we do, in addition to the 90 essential nutrients, is more essential fatty acids and more B vitamins, B like baby. Okay. The Longevity supplement that carries the lion's share of B vitamins is De-Stress. It's called De-Stress, like detoxify, De-Stress. So the recommendation, 1 bottle of De-Stress per 100 pounds of body weight per month, 1 extra bottle of EFA Plus or multi-EFAs, on top of the Healthy Body Start Pack 2.0 liquid, selenium, and plant-derived minerals appropriate for body weight, plus a diet high in cholesterol and zero tolerance for the 10 bad foods. Now, I was just at a naturopathic conference a couple of months ago, and interesting, research is showing that bisphenols, which are found in the water of bottles that are in, plastic, everybody's plastic water bottle. You go to the grocery store and buy 24 bottles of plastic water, right?
Right.
Well, there's a chemical that leaches out of the plastic called bisphenol, and when bisphenols go into the blood, they do the same thing to the blood-brain barrier that gluten does to the gut.
Wow.
It interferes with the tissues in the blood-brain barrier, making the blood-brain barrier more leaky. And listen, the blood-brain barrier isn't what medical doctors think it is. I learned this from Dr. Wallach. But it is a structure, and it does have some type of protective mechanism. But the bisphenols in water from plastic bottles mess with that. So the recommendation is, and this is hot off the press, by the way, and I don't make recommendations that aren't supported by really, really good clinical science, not just a couple of research papers, but, there has to be really good, legitimate science here that I have to pour through and see that there's not any bias in it, and that's not easy to do. So my recommendation is just stay away from water that's been in plastic bottles because it's loaded with bisphenols, and it's going to mess you up over time.
It's funny you said that because my grandmother, they have said that she has excess fluid. They had to actually do a spinal tap to release it, and she started, her memory is just, everything started to come back just a little bit. Like, she seemed a little more normal when they did that. They were saying that, obviously it was doctors, but they said that, she was, she had excess fluid, around her brain.
Yeah, so that's a circulatory problem. When fluid accumulates anywhere in the body, it's because the circulation is messed up. And remember, it's the circulation's job to bring stuff to the tissue and then to take stuff away from it. And just like the drain in your sink, if that gets clogged, well, the sink's going to fill up with water. Well, when, your circulatory system gets messed up, then fluid's going to build up anywhere. And in this case, it builds up in the central nervous system. That's not good. So given that amount of information, I would switch the de-stress to the Ultimate Daily Capsules. I would switch from the de-stress to the Ultimate Daily Capsules and make sure she gets 100,000 ORAC of antioxidants a day. The easiest way to do that with elderly people is triple treat chocolate, right? Give her 4 or 5 pieces of triple treat chocolate a day. And you know what they say, man, that beats a poke in the eye with a sharp stick. Thanks, Demetrius. I appreciate you very much. Frankie is here from Texas. Hey, Frankie, do you have spurs that jingle, jangle, jingle?
I just had a question about, I listened to a CD saying that cataracts can be reversed, and I had gone to a doctor, and they were wanting, said the cataracts were pretty bad, and they're wanting to do cataract surgery. But he said, I may see better, but I may see worse because of the condition that I have in addition to that called Fuchs syndrome. So I was wondering what you have that, I really don't want to have surgery. And so is there anything that can reverse the cataract?
Well, I've heard about things that reverse cataracts. I've never seen it in clinical experience. I've had people come up to me and tell me that they used to have cataracts and they don't anymore, and I have no reason to believe that they were lying to me. Okay. So, anecdotally, I've read about it and I've heard about it secondhand. I've never seen it clinically. I think I've maybe only treated cataracts maybe 3-4 times in 25 years, if you can believe it.
Wow.
So I'll tell you what we believe the mechanism is, and this is worthwhile thinking about and thinking through because, the cataract itself is not the disease. It is the result of the disease. It's the lens of your eye has become cloudy. The lens of the eye has become damaged. We believe it's free radical oxidative stress that's damaging the lens of the eye. Now, you don't get cataracts because you have a lens. You don't get cataracts because you have an eye. If that was the case, then everybody who has eyes would have cataracts, and that's not how it goes.
Okay.
So even if they do surgery, right, that's not going to fix the process that caused the lens to get funky in the first place.
Okay.
That process is still going to be at play in the body, and it's only a matter of time until something else somewhere else breaks. It's kind of like painting over the mold in your basement with paint, right?
Okay.
I mean, even if it's Glidden paint, it's not a good idea because
Right.
you're just painting over the problem and you're not really fixing it. So
Right.
surgery, even if the lenses are too far gone, well, surgery is going to help you to see better. Maybe not perfectly, but it'll help you to see better than it would with a cataract. But it's still not going to fix the problem that caused the cataract to form in the first place.
Right.
So we need to get on board with a program that will do that.
Okay.
And then, give a little extra lens support, keep your fingers crossed and see what happens, because this is a non-life-threatening surgical procedure. You're not going to die if you don't have it, so we might as well give it the old college try, right? I mean, that just makes sense. You stick around with me, Frankie. I'll pull you up immediately after the hard break. I appreciate your patience, and more importantly, I appreciate your trust. I'm Dr. Peter Glidden, ladies and gentlemen. Stick around. And, ladies and gentlemen, spent 2 hours with yours truly. Every day we learn a little bit more. I know that I do. I hope that you do as well. Remember, knowledge is power. Your doctor does not know what's best for you. They only know what they've been trained in, and what they've been trained in is just one small piece of the pie of medical science. There's a much more to know about medicine, and we bring that knowledge to the table every day of the week from 3 to 5 p.m. Central Time. I appreciate your indulgence. Let's finish it out with Frankie. Frankie, you still with me?
Yes, sir.
All right. So the recommendation here is that this is a comprehensive, holistic approach, right, which is what makes us so interesting and so unique. Because we just, we kind of clear the deck, eliminate food that's hurting the body, and then give the body everything it needs in absorbable doses and damn the torpedoes type of a deal, okay? So the recommendation is eliminate all 10 bad foods. Now, that includes oil in a bottle and fried food.
Okay.
So our belief is that, this problem with the lens is caused by an overabundance, a superabundance in your body of something called free radicals. And free radicals are everywhere all the time, but there are certain foods that are high in free radicals, and it would be a smart idea to stop eating them because we get enough free radicals just from walking down the street and breathing in automobile exhaust. So eliminate the 10 bad foods, please, number one. How much do you weigh, Frankie?
About 130.
All right. So you would need 3 bottles a month of Ultimate Selenium, because your body has a fire department which puts out the fires of inflammation, the same way that it has a police department, which is your immune system. And selenium is the captain of the fire department of your body. Selenium is essential in your body being able to put out the fires of inflammation, which are just a normal part of life.
Is that liquid or capsule?
Capsules. It would be Ultimate Selenium. You would need 3 of those, 3 bottles a month, and that's 9 a day. The recommendation there would be 3 capsules 3 times a day between meals. It's best to take that between meals. If it makes your stomach feel a little funky, then have a little bit of yogurt or a banana or some fruit. Okay. But it shouldn't. The capsules are small. They go down easy, and there should be no harm and no foul.
Okay.
All right. Now, the next thing for you to do is figure out a way to get antioxidants into your body in large numbers. Now, antioxidants are measured by their ORAC score. That's ORAC. Generally speaking, for general health, the recommendation is between 20,000 and 50,000 ORAC a day. In your case, because, the game is afoot here and there's oxidative damage rampantly in your body, the recommendation would be for you to secure 100,000 ORAC points of antioxidants a day. Now, different foods have different amounts of antioxidants, and you're going to have to figure this out. You can go to my Facebook page, the Dr. Glidden Facebook page, and you can go to Wellness Warriors on Facebook, and you can interface with the community there and try to figure out how to get more ORAC into your body. Longevity has a couple of supplements that are loaded with ORAC. The easiest and I think best tasting is a chocolate. It's called Triple Treat Chocolate, and one piece of chocolate has 19,000 ORAC points, and that beats a poke in the eye with a sharp stick. So 5 pieces of chocolate a day, you're good to go. So that's one option. Food, beverages, green tea, red wine, things like that, or cinnamon curry powder. But you'll be able to figure it out. You sound like a smart woman. Now, in addition to the increased antioxidants and the selenium, we need to round this out. And we do that by giving your body all 90 essential nutrients in a dose appropriate for your body weight. The best way to get that is with one Healthy Body Start Pack 2.0 liquid. It's a ponderously long name. It's called the Healthy Body Start Pack 2.0 liquid. You need one of those a month. And 2 bottles, please, of plant-derived minerals. 2 bottles of plant-derived minerals. You should be good to go with that program. That's what I would do. There's also a homeopathic eye drop that I've heard anecdotally is helpful here. It's called Cineraria maritima. Cinnereria maritima. You'll have to Google that. Longevity doesn't make it. Cineraria maritima eye drops may also be helpful. I would pursue this therapeutic for 90 days in a row. Keep your fingers crossed and see what happens, and call us back with a track record. I'd look forward to that. Next live event tonight, ladies and gentlemen, 8 p.m. Central Time, live chat for Dr. Glidden Insiders. See you then.